17 News at Sunrise is Kern County's newscast for moms. With that in mind, one of the topics we are focusing on this year is safe sleeping. An unsafe sleeping environment is consistently present in the majority of infant deaths in our county. Experts say these deaths are preventable. The Kern County Network for Children's latest report card reinforces those findings.
We're encouraged about some of the health indicators that we've seen. We have more women getting prenatal care. We continue to promote that. We also have more kids getting immunized in this county, but we still have lost, since 2009, about 54 kids to unsafe sleeping conditions.
According to the report card, in 2013, 99 Kern County babies died before their first birthdays. That's an increase in infant mortality of 17%. Deaths linked to unsafe sleeping environments continue to be the leading cause of infant death in cases looked at by the Child Death Review Team. By our count, last year, unsafe sleeping conditions were present in 17 of the 21 infant deaths reported by the coroner's office. Already this year, 8 children ranging in age from 13 days to 8 months have died. While the causes of many of these deaths are still under investigation, trends show us unsafe sleeping will likely be a factor in about half of those deaths.
For some reason, continue to have parents that feel it's okay to co-sleep. And we know that at least one child per month, co-sleeping is a factor in that child's death. We need to encourage parents, even though it's very tempting to do, to not co-sleep with their children.
And it's something that we're going to continue to talk about and look at throughout the year.
A problem plaguing Kern County, a problem that can be solved. 17's Kristen Price continues to examine a deadly practice every parent should know about: safe sleeping. Tuesday morning on 17 News at Sunrise.
Jim, already this year, 8 infants between 13 days old and 8 months have died in Kern County. Where an infant sleeps is a common thread in many deaths of young children. And the autopsy for Lyric Hansen is still pending, but today his mother told me she believes her son would still be alive if she hadn't slept with him. Public health experts say that is the case in many infant deaths. Bringing a baby in bed can be comforting to a fussy newborn and a parent, but you run the risk of accidentally killing your baby. Good to have you with us for Kern County In Depth. I'm Kristen Price in for Jim Scott. When an infant dies a violent death, it usually makes headlines. But a much larger number of babies die silent and completely preventable deaths, often in the arms of adoring parents who simply didn't know the danger in which they'd placed their precious son or daughter. I'm talking about unsafe sleeping, by far the biggest danger facing children before their first birthdays. The number of babies dying in bed with their parents or surrounded by pillows and blankets is increasing. Last year, 17 infants died due to unsafe sleeping conditions. These are preventable deaths. I spoke with a mom who experienced this unthinkable loss. She is sharing her experience with the hopes of preventing more infant deaths.
He was a really good baby. He just liked to eat and made all kinds of funny noises.
Ben was born on October 20th last year. Shortly after, his mom, Amanda Salcedo, began sleeping with Ben in her bed.
I knew it would be easier. I've read that it makes breastfeeding more successful. I even slept with my older son in bed.
Many parents who bring their babies into bed have the same thought.
I knew it would help us to get more sleep, which, looking back now, I would have rather not slept.
The day before Ben would have been 1 month old, Salcedo woke up to her baby in her arms, unresponsive and lifeless.
When I woke up, we were facing each other, and it just happened.
Ben's death was ruled positional asphyxiation due to unsafe sleeping conditions.
One day you wake up and it happened to you, and sorry. I just really want people to know that, you know, this is a risk, and I don't want anybody to wake up to this like I did.
Salcedo says she was careful while sleeping with Ben and thought she was doing it safely.
Apparently you can still take all the precautions and you still wake up to the worst thing ever.
Perinatal investigator Rose Cochran says Salcedo's story isn't uncommon.
Nobody ever puts a baby in bed with them thinking something bad's going to happen. They really do it with the best intention, with love in their heart. But it can happen to them.
Unsafe sleeping was a factor in 17 infant deaths last year. Already this year, 19 babies have died. The coroner has not yet determined the cause in some of these deaths, but unsafe sleeping was a factor in at least 9 of those cases. That number will likely increase.
We're not saying you're a bad parent because you can't stay awake. You're human. Everybody gives into sleep. Everybody does. Just make sure that you lean over and put the baby in somewhere safe.
Salcedo wishes she had done that and hopes parents learn from her story.
If he had been sleeping alone on his back in his crib, you know, and he would have passed away that way, I don't think I would live with the guilt that I do. And the guilt is something that I'll always live with, and I don't want anybody else to ever live with it.
Joining me today for our panel discussion, Kern County Network for Children Executive Director Tom Corson, Elaine Anthony, Maternal Child Adolescent Health Coordinator for Kern County Public Health, and Dr. David Merzel, who specializes in pediatric critical care. Thank you for joining me today. And I should also mention you are all on the Child Death Review Team board.
That is correct. And Kristen, first of all, I want to thank you guys for highlighting this story once again. I know this has been something that 17 has really tried to get the message out about the dangers of co-sleeping in unsafe sleep environments. And I thought I'd just start with reading a statistic that I think people will think maybe twice about co-sleeping. Between 2009 and 2014, we've had 71 deaths where co-sleeping in an unsafe sleep environment have been a factor. This year, at this point, we're averaging about a death per month, and we're at about 21 additional deaths. So in the last 6 years, we've had over 92 deaths where co-sleeping or unsafe sleep conditions has been a factor, and that's about 15 kids per year. We should be outraged as a community. We should try to figure out ways to advocate and just get it through people's heads. It is unsafe to sleep with your child or to have your child in an unsafe sleep environment.
So the most recent report that you released, the Child Death Review Team released in October, said last year there were 17 infant deaths,
correct.
So a little bit higher than the average. What did you see in this most recent report?
Well, one of the things we see a lot is we see parents and caregivers putting the infants in things that aren't made for babies. For instance, couches, kids falling between couches, putting them on bedding where there are a lot of pillows. Basically, there's only one environment for a kid to be, and that's without pillows, without blankets. And I think Elaine can talk more to what that environment might look like.
Well, also when you place your baby to bed, and you need to make sure that they have their own safe sleeping environment. And that does not include the baby sleeping next to you. Yes, you're breastfeeding, but if you are breastfeeding, go ahead after you're done feeding the baby. I know you're sleepy. Make sure you just take that baby and put them in their own safe sleeping environment. Whether it could be an attachment to your bed, a bedside crib, a little bassinet, what have you. A little drawer with a blanket in it, doesn't matter. There are resources out there for you if you do not have a safe sleeping environment for that baby. But the key is the baby needs to have their own place to sleep, a safe place to sleep. And we're also seeing that parents are putting down their babies to bed or they're going to sleep. And we see this with Child Death Review Team, that there's like a trend where the parents may not be all alert because they might have taken some medication, they might have drank some alcohol, they might have really sleepy because they had a really bad night, bad night sleep before, and they're really sleepy, and so they're incapacitated and not able to take care of their baby like they should. Well, then if that's the case, then you need to make sure you get someone in there who is alert, who has enough sleep that they can take care of the baby while the parent can sleep. And we're seeing that problem a lot.
And Dr. Merzel, what happens? It's not just overlay. They could be getting their carbon dioxide back. Can you explain that?
Among the many things Mr. Corson mentioned is suffocation. You don't have to actually put a blanket over a baby's face and smother it. Just having the baby's head near too much fluff, there's not enough oxygen. So the carbon dioxide just accumulates in a little cloud around the baby's head, and the baby dies of lack of oxygen, the medical term being hypoxia. So yes, you can have the baby's head buried in a pillow. You can have the baby's head fall between a mattress and a wall. You can overlay if the parent is so tired they don't know the baby's there. But just too much stuff in an improperly made sleeping environment can cause suffocation just because there's not enough air in a mass of fluffy pillows and blankets. So it really, you have to follow the recommendations. The science is not new. These recommendations have been around for a long time, and the general public needs to be educated. The medical community needs to be educated, because we catch medical practitioners at all levels, doctors, nurses, well-meaning people in hospitals not giving the right information. So it really is a community-wide issue.
And Elaine, SIDS and SUID cases, they're often lumped together, but can you explain what that distinction is?
The distinction between SIDS and SUIDs is that SIDS is this sudden death of an infant that when they try to diagnose it, it's a diagnosis of exclusion. The death scene investigation, the child's history, health history, and the manner of death, it does not coincide. They can't come up with a reason. The coroner cannot come up with a reason how that baby died or why that baby died. Now, with SUIDs, that's basically an umbrella term, where SIDS falls under it, but also you have asphyxiation, strangulation, and unknown causes that are under SUIDs.
So these deaths are preventable. Why do they keep happening?
We just got to get the information to the public. We got to get people just to see this as an issue. I mean, you know, 92 kids in the last 6 years, and these are, for the most part, these are accidents. Occasionally, yeah, we see the parent that has a drug or an alcohol problem, and it's just really negligent. But for the most part, these are accidents, and these parents now have to live with the fact that they lost their child. And a lot of times, it's like they've said, the mom is tired, maybe breastfeeding, and dozes off, and then there's an overlay. We just have to get the public to understand, do not sleep with your kids and keep them in a safe sleep environment.
And last year we had 17 infant deaths. Is this a high number compared to other areas?
Yeah, it's actually 50% of all considered accidental deaths to children in this county, and they're all for kids under the age of 1. In 2009, we had a spike. We had 25 kids die due to unsafe sleep conditions, and this year, unfortunately, we're not at the end of the year yet, and I'm hoping that we don't see any more deaths this month. But it's quite possible now that we're in a colder time of the year where people bundle kids up.
And it's more common that it happens in colder months, right?
Yeah, it's more common. But again, even in the summer months, it goes back to what Elaine was saying. Parents come home, they've had too much to drink. They either put their child in a vulnerable position on a couch, or we've even seen children being put to sleep in car seats and they've rolled over. You know, they've set them on a car seat in the bed with a baby in it, and the baby rolls over. For a parent, that's got to be the most devastating thing in the world to live with. But it is preventable.
And I want to get to also these GIS mapping, the Geographical Information Systems map. That's something new in the report. And we have a couple graphics with those. This is the one for Greater Bakersfield, and there's dots representing each death where they happen, and then the darker colors are higher levels of poverty. So how does poverty play a role in these deaths?
Well, I think in most of the statistics we see, whether it be child deaths or other issues, poverty does play a role. People are struggling. They may be less likely to have the proper sleep environment. So we're working with public health and other programs to make sure that they do have a proper sleep environment. And I don't know if there's something that you have seen from the medical standpoint, Doctor?
I think you have to look for the problem to find it. And what I learned being on the committee was that Kern County is a little bit ahead of other counties, because some will just lump it as SIDS. But when I read the reports, I see how people are actually looking to see if this is a problem. And they're specifically mentioning the sleep environment in these investigations. And it could be a crime scene investigator, it could be a police officer. You won't find the problem, you won't identify it unless you look for it. And I think this whole team has really been at the cutting edge of identifying the problem and then bringing it out to the public. Because many places are not identifying the problem. They're not looking for it.
And that's why it's hard to compare statistics statewide, because some counties aren't collecting the data the same way we are or reporting it. Public health is really taking a lead, though, with the GIS mapping, because what it's doing is showing where concentrations are. And if we need to put up posters or brochures in certain areas of the community or knock on doors, that gives everybody a target. So the GIS mapping is the first time, and I think it's exciting that we've kind of moved to that level with the Child Death Review Team.
And when we come back, we're going to talk more about the map, and with Kern Medical Center CEO Russell Judd, he's going to join our panel. Welcome back. Russell Judd, the CEO of Kern Medical Center, is joining us now. Thank you so much for being here.
Thank you.
So now kind of bringing this full circle.
Sure.
Death review team has gotten the information.
Child Death Review team did their annual report to the Network for Children's Governing Board. At that board meeting, John Nyland, County Administrative Officer, and Matt Constantine, Director of Public Health, heard this information and immediately reached out to Mr. Judd and said, we need to do something about that. KMC immediately jumped up, and I think they're going to do some exciting creative things in this county.
Yes. Well, thanks, Tom. You know, I think, frankly, as a healthcare leader in the community, we were unaware. I think the community has been unaware of, first of all, the number of tragic deaths that occur that are preventable. And when I heard this, I shared it with the team at Kern Medical, and we said, yeah, we can do something, and we can do something quickly, we can do something effectively that will make a difference. Many of the patients that succumb to this tragic accident are Kern Medical patients. These are our patients. These are the people that we care for, that we're committed to. And so when we got this information, we've gathered some more facts. We are getting ready to announce and to launch a complete countywide safe sleeping campaign so that education is provided at that very first beginning part of life, and then every time an infant interacts with a healthcare provider. So that education is provided, so that the basic care of infants, and not just the mom when they go home from the hospital, but when they're in their pediatric clinic at their well baby checkup, when they come for 6 months for some immunizations, just that constant reminder of how you provide safe sleeping habits. We are in discussions with some of the manufacturers of porta-cribs, of sleeping devices, that we think it'll be very exciting of not just providing education, but also providing accessories and help to these patients, and most importantly to the families, to the moms, to the aunts, to the grandmas, about how and what they need to do for safe sleeping habits.
Because all the hospitals do, and most pediatricians' office have information. It's usually in a pamphlet form, right? Why is it so necessary that it's something other than just papers that are given to them and they go home with?
Well, I think papers, you know, you've just had a child, let's say you've brought a child in that has a medical need, you may be in crisis or stressed out. You give me a bunch of papers, it's probably going to get thrown in the dumpster. What they're talking about is something more hands-on, more realistic, a real social marketing approach, maybe with even goods leaving the hospital, that's going to have a greater impact.
And it's overcoming a huge obstacle. You know, there's many cultures that we care for and live in our community, and for generations, moms have been laying babies on their stomachs, have been putting blanket after blanket after blanket on top of them, and it's just really more, we've got a big hurdle to overcome, therefore we've got to put forth a big effort to overcome that hurdle.
And also, there's things that everyone can do, right?
Sure.
You have compiled a list of how you can make a difference, and we have some of those graphics with those suggestions. So what are some of the things that you should do if you see someone?
Well, talk to them, educate them. You can go to our website, www.kcnc, and there's a link called Kern Cares, and there's a lot of information that parents can do and resources as well. And it's just educating people. I mean, my mom slept with me, and I'm sure others were co-slept with his children too. I'm alive today, but that doesn't necessarily mean that there couldn't have been an accident that could have taken my life. So even today, educating my mother, who's older now, can educate her friends that have children now with grandbabies and other things.
And another thing is just discussing with your family and friends. But since I've been doing these stories, I've gotten feedback from people that say, you know, I met someone that was telling me all about how they sleep with their baby. It's awkward. How do you have that conversation?
I would basically tell them, why would you take that risk? Why would you take that risk that your child is not going to live because you are so tired or you've taken medication or what have you, that you can't take care of your baby? I know that doesn't sound right, but if you know your baby is going to sleep, you want your baby to be safe and sleep and while they're sleeping. So be vigilant and take all precautions so that baby is safe when they're sleeping. I mean, it's really that simple.
Sleeping with your baby doesn't mean sleeping on the same bed. The baby can be next to the bed. There can be a crib or a porta-crib type device immediately next to where you're sleeping. That doesn't mean you're not with your child. You just don't want to be on top of the child. They can be 2 feet away, but in a safe sleeping environment.
Do you have any more insight on how to bring this up without feeling uncomfortable or?
I'd make a comment to that. I liken it to, let's go back, not quite a generation, but almost, when it was car seats. When, I can remember just laying the kid on the back seat. And I'm sure there were some difficult conversations and it was hard, but now it's just become part of what we do. Nobody would have a hard time going up and saying, you left that baby not in a car seat, or even children left alone in cars. If one of us walked by a car and saw an infant in there by themselves, we would do whatever it took to save that. I think it's just going to take some courage. It's just going to take vernacular. It's just going to take someone to step up and say, I care for you, you're important, I know you love your child, give it the very best opportunity, and love them in other ways, but don't sleep with them.
And the goal is just to make that the new norm.
That's right.
Exactly.
All right. Thank you so much. When we come back, we'll take a look at a safe sleep area and an unsafe sleeping area. Welcome back. We're talking about safe sleeping. So now we have two examples of what is safe sleeping and what is not. What do we have here?
Well, the unsafe sleeping environment for the baby is when people are like laying soft objects over the crib or the playpen, and that could easily fall into the playpen, and then the baby will have more items that they have to contend with that will probably fall over their heads, and then they can't breathe. They put extra items, extra blankets in there because they think that the baby's cold, or they want to make their own baby bumpers. We don't want baby bumpers. We don't want anything extra with the baby. They prop the baby up with a bottle, and they don't have the baby on their back. They have them on their side, where the baby can easily fall over onto his tummy. We don't want that. What we do want is a safe sleeping environment for the baby, where the baby doesn't have the baby bumpers. The baby is in a crib new enough where the mattress and the crib, the frame are really tight. There's no possibility of the baby wedging into the mattress.
So a firm mattress.
A firm mattress.
And nothing else in there.
Yes. And then you want the baby to be, I know we're going into winter, you want the baby to be zipped up in one of these safe sleep sacks, like the safe sleeping environment here, and nothing else with the baby.
Another thing you mentioned too is blinds, not too close to anything that could.
Yes, we've had a couple instances in the last fiscal year in child death review where we've reviewed cases where the crib was up against the window, and unfortunately there was like a mini blind, and these babies got caught up with their arms into the mini blind cord and ended up wrapping their heads around.
And sleeping in a crib or sitting up also.
Sitting up, people also put them in a car seat or a swing. The baby is 3 months old in a swing. They don't have the neck muscles to keep themselves up, and plus there's all this soft tissue. So when the baby's slumped over like that, there's not that much breathing areas for their lungs to be fully used, and therefore they end up suffocating right there in the swing or in the car seat.
All right, thank you so much. We'll be right back. If you need help or resources, here are some important phone numbers. If there's an emergency, call 911 first. To report child abuse, call the Child Abuse Hotline at 631-6011. If you need information, you can call the Kern County Network for Children at 636-4488, or you can call 211 Kern County, a program of Community Action Partnership of Kern. In many of these deaths locally, families could not afford a crib. You can help local babies have a safe place to sleep. A playpen that doubles as a crib can be purchased for as little as $39. Go to our website, kerngoldenempire.com, and we'll show you how you can make that donation without even leaving your house. You'll also find information about Benny Bears. It's a nonprofit organization created by the woman we introduced you to in the beginning of our segment. Amanda Salcedo created Benny Bears as a way to educate other parents about the dangers of unsafe sleeping. She created a teddy bear with safe sleeping information and a web link to Ben's story as a reminder of the very real danger of sleeping with your baby. Salcedo hopes to get Benny Bears in hospitals around the country. For all of us here at 17 News, I'm Kristen Price. Have a great weekend.
Regret's a horrible thing. You can't take that away.
It's an unimaginable moment for any parent, finding your baby not breathing. Infant deaths aren't usually witnessed.
We've really spent a lot of time trying to piece together the parts of the puzzle about what might explain the infant's death.
By my count, there were 7 deaths so far this year and 21 deaths last year of children under 1 year old. Last year, 2 infant deaths were ruled accidental by asphyxia and strangulation. One was caused by a car crash, one from a natural medical condition, 1 homicide, 1 is still under investigation, and 15 are classified cause undetermined, SUID. While there might not be an explanation for the cause of death, unsafe sleeping is noted in 17 of the 21 deaths, including all 15 cases of SUID.
We find that suffocation is often an issue, or a situation where a child may not be suffocated but may breathing back their own carbon dioxide, not getting enough of oxygen in the airway because there's so much stuff in the crib.
Dr. Philip Hayden oversees the Child Abuse Center at Valley Children's Hospital in Madera. He also reviews child deaths in Kern County and says many infant deaths are preventable.
The mom fell asleep, she rolled over on the baby, didn't crush the baby in any way, but kept the baby from being able to breathe. And so then the mom wakes up, the baby's cold and lifeless.
Sleep always beats you, and it doesn't make you a bad parent. It makes you human.
Public health perinatal investigator Rose Cochran provides community education on safe sleeping.
I don't think any of these parents wake up and say, well, I'm going to intentionally put my baby to sleep and hurt them. That's never what they're thinking. They're thinking, really, I love my child and I want to do the best thing for them. And they're actually parenting what they saw and what the parents did for them.
For many parents, that means bringing the baby into bed. That can seem especially comforting to a fussy or sickly newborn who can't seem to sleep on their own. It's comforting for mom or dad, too, to cuddle with the new child, especially when the parent is exhausted by a long day, followed by hours walking the floor with a crying infant. Cochran says it's a dangerous habit parents often don't realize can be deadly.
We just kind of love them to death. And it's always with the best intention.
A group of local experts reviews and tracks all the child deaths in Kern County, and they will put out a report in a few months. And joining us this morning, Child Death Review Board member and Kern County Network for Children Executive Director Tom Corson. Thanks so much for coming in this morning. So what do you expect this report to say about how children are dying?
Well, in 2014, we reviewed approximately 60 or so cases. A lot of those cases, children die due to natural causes, some automobile accidents, and some other things. We lost 2 children to abuse last year, but this underlying thing we continue to see is a very high percentage of children dying due to unsafe sleep conditions. And when we look back to 2008 to 2013 or 14, excuse me, we've lost 54 kids with unsafe sleep conditions being a factor.
And what would you say to someone who thinks this can't happen to them?
It can happen to anybody. And again, as Rose said in the piece, you know, you're loving your kid to death. A mom and dad tired, kids crying, they pull them into bed thinking that, you know, I'm not going to roll over on my child. I've done it before. But again, it can be carbon dioxide poisoning. It can be other reasons why that child is unable to move its head. And it happens suddenly and it happens silently.
And something that Kern Cares stresses a lot is accountability. How can people hold others accountable?
Well, you go into a store and you see a crib being sold and it's got all these toys in there and blankets and stuff. Talk to the store manager, make it look like a safe sleep environment. Your friends, family, if they have an infant, remind them. Don't use alcohol or drugs around your infant. And also make sure that we're doing everything we can to educate the community and what resources are there for those families that maybe can't afford a crib. Please contact our office.
And another thing you mentioned is holding the media accountable.
Yeah, the media, really, we want the media to report these unsafe sleep conditions, but also promote safe sleeping. You know, people say, well, my parents, you know, slept with me, but we need to educate people, just like we've done with seatbelts and other kind of social issues.
And with the cribs, the address that we've provided on our website, those will go to you and then be distributed.
And we'll get them into the right hands of the people that can't afford a crib, that need a crib, to make sure that child's safe.
All right, thank you so much for joining us this morning.